Welcome to our first bite-sized video, where we aim to provide you with a brief overview of some parts of the Act applicable to the ELC sector. This video will be focusing on the guiding principles from the first part of the Act. As we all know, the foundation for improving children's outcomes and providing quality care is based on the quality of our staff teams. The training and values of the people who work in your settings underpin the quality of experiences and opportunities children receive each and every day. The Act aims to enable high-quality care and improved outcomes for people using services in both health and care by helping to ensure appropriate staffing. Our national guidance documents, such as Realising the Ambition, and national frameworks, including the Blueprint 2020, which documented the Scottish Government's vision for the expansion of ELC, all recognise that a high-quality workforce is a key driver in providing high-quality care. There is a link between the safety of people who use services and the well-being of individuals delivering the service. This legislation aims to promote increased well-being of staff working in the care sector. Part 1 of the Act is for all social care services. It gives the foundations of the Act and tells us about the guiding principles and why it is important within social care. The Act states that the main purposes of staffing for health and care services are to provide safe and high quality services and to ensure the best care outcomes for people who use services. The rest of the Act is all about making these main purposes happen. Services should be able to discuss how they have considered the guiding principles and use them when making decisions about staffing. So all services need to be aware of what the new legislation entails and consider how they will ensure they meet the expectations set out. There are 8 headings on the slide. These are the principles of the Act and must be considered when arranging staffing in any service type in order to achieve the main purposes set out in the last slide. Most of these headings are similar to the expectations set out in Regulation 15, and I'm sure you will be able to identify some areas of good practice within your own services in these principles. For example, through quality improvement and the introduction of the health and social care standards, we are already working towards the first principle of improving standards and outcomes for children. The second principle of taking account of individual needs, again, is something many services do very well. The recent launch of the Care Inspectorate's personal planning guidance would support services to meet the second principle, and there are bite-sized videos on the ELC Improvement Hub with further details to provide support for this principle. One principle we wanted to draw your attention to today is an addition to current legislation, that being the well-being of staff. Many of your services may already have measures in place to consider staff well-being. There is a link between the safety of people who use services and the well-being of individuals delivering the service. This legislation aims to promote increased well-being of staff working in the care sector, with the expectation that supporting staff's well-being can reduce sickness absence, burnout and work-related stress, meaning that they are available to care for people using services. In order to provide safe and high-quality services, appropriate measures and checks will need to be in place to achieve and maintain the well-being of individuals working in the service. What that will look like will differ between services, and it's about finding processes and measures that meets the needs of the individual services and staff. The focus is on staff well-being insofar as it affects the main purposes of providing safe and high-quality services and ensuring the best care outcomes for children. The important thing services should be aiming for is that it is safe for staff to raise issues without fear of retribution, and that there's a culture of service improvement, transparency and open communication. This was a brief overview of the first part of the Act which is applicable to the ELC sector. Please review our other bite-sized video which provides an overview of Part 3 of the Act. Further support is available on our hub page, and we have linked information from the statutory guidance that accompanies the Act with reference to some guidance documents you may consider under each principle.